Hello, my name is Joe Ebner, and I'm the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. I want to welcome you today to this COVID-19 update, dated Friday, April 24th, 2020. This is intended to be a COVID update for the greater Plymouth community serving central New Hampshire. I want to again thank you for your efforts at social distancing and isolation efforts. We have certainly flattened the curve across New Hampshire and are on the downward side of the COVID epidemic in our community. Many predictive models placed the United States peak roughly 9 days ago. And so for most of the country, we're starting to see a decrease in new cases. And as many of you are probably aware, some states are starting to open up and relax their social distancing policies. But what about New Hampshire? New Hampshire's prediction of peak was about 15 days ago, on April 9th. New Hampshire hospitals remain in good position with staff, beds, equipment, and personal protective equipment for their healthcare workers to care for you. And this is all in thanks because of your social distancing that we started about a month ago. Our state's hot spots continue to be along the New Hampshire border in southern New Hampshire. To our colleagues there who are still up to their elbows in COVID cases, we continue to send them our warm wishes and thoughts. Most of the COVID prediction models has New Hampshire past this epidemic at some point during the month of May, which is right around the corner. At the current time, 1,600 cases of COVID-19 have been diagnosed in the state of New Hampshire, with 51 deaths attributed to COVID. This is a 3% death rate. We've had 218 hospitalizations because of COVID, which is a 13% hospitalization rate across the state. We have recently, in the last week or so, seen an increase in cases because of increased testing, largely because of the recent long-term facilities like nursing homes, increase in testing in their population, in their patients, and in their employees. The hospitalization rate for COVID-19 has remained pretty stable and flat over the last 3 or 4 weeks. What about our local community here in Plymouth, New Hampshire? We continue to have had 4 positive cases through Speare's lab. We send all of our lab testing for COVID down to a laboratory in Massachusetts, which gives us a 24-hour turnaround time. And we have not had any increased cases in the last couple of weeks. Just as a reminder, what has been Speare's response to this pandemic? Firstly, all of our practices are open to telehealth, except for White Mountain Eye Care. This is also true for Mid-State Health Center. What is telehealth, you might ask? It allows you as the patient to have a visit with your doctor, your physician's assistant, or your nurse practitioner from the comfort of your own home, using a secure, web-based or application on your cell phone. Many appointments with your doctor can be handled this way. Let's say a check-in on how you're doing, or to review your medications, or to review any other forms of therapy you might be in need of. However, there are going to be times when you need to come to the hospital or see your physician. Please don't hesitate to call the office or to come to the emergency room if necessary. The other thing that we're doing is throughout the hospital, from the time you arrive in the emergency room through all the floors upstairs, we continue to separate those with respiratory illness that could be possible from COVID-19 from the others in the hospital. Our public health emergency partners have also helped with our Plymouth Alternative Care Site, the PACS, which is a stand-up hospital on the floor of the ice rink at Plymouth State University, which can handle up to 100 additional patients. We have not yet needed to use that facility, but with a 3-day heads up, that can be a fully functioning hospital. At the current time, it is unlikely that we'll need that space. We will maintain it and keep it there for a day when it might be needed in the upcoming months. But at the current time, the team there is working to document what they've done so that if this pandemic comes back or something similar, maybe this fall or in a year or in 2 years, they'll be able to more efficiently get that space up and running. What do we know about COVID-19? Most infection comes from extended, sustained, close contact to someone with symptoms or who's about to get symptoms in the next 48 hours. And the majority of this infection comes from hand-to-face contact. What can you do now to keep yourself safe? Wash your hands frequently. Either a 20-second scrub at the sink with soap water or an alcohol-based hand sanitizer will work. Avoid touching your face. Sneeze into a tissue and throw it away immediately and wash your hands. Maintain that social distance of 6 feet from others and avoid crowded places. At times when you do need to go to crowded places, for example, the grocery store, plan on wearing a cloth mask or a cover over your face. These will decrease any asymptomatic spreading to others and prevent you from touching your face. Lastly, clean frequently touched surfaces around your house. As I've mentioned before, if you are feeling mildly ill, stay at home and plan to call your doctor. They might plan a telehealth visit and decide from there whether you should come into the hospital or come into the office. If you are feeling severely ill and feel you need to be seen, again, call your physician. If you feel that it is emergent, mostly because of shortness of breath and hard time breathing, please come to the emergency room anytime. If you have a question about what to do or who to call, please see at the bottom of the screen the hotline for Speare Memorial Hospital, 603-238-6464. This phone is answered 24/7 by a member of our nursing staff who can direct you on where you should go. Many of you are now asking, how and when will social distancing precautions be lifted? Please know that we continue to engage with hospitals around the state multiple times a week, as well as with the Governor's Office, the Department of Health and Human Services, and the Departments of Public Health about how to proceed with a cautious, coordinated, regional, and statewide opening up of services, businesses, and other activities that bring people together. We want to make sure that it is a slow and phased approach as we move from the current strategy to one of containment. There's a couple of things that we know we're going to have in place prior to opening up commerce. First, we'll need to ensure that the healthcare system, from the top of the state in Coos County down to the Massachusetts border, are ready to accept a potential second wave, meaning that there's plenty of PPE for the workforce. The state is working on that. Secondly, we'll need to improve our testing capability. We are also working on that with the state so that more people who either have symptoms or don't have symptoms can be tested. We also have to work closely with our public health experts at improving our contact tracing resources so that if we begin to open up commerce and we can identify that someone with COVID-19 was seen in a certain place at a certain time, that we have the ability to trace people who may have also been exposed and to continue following them for 1 or 2 weeks to ensure that the disease remains contained. We'll also need to continue to work on supporting those in isolation at home during a time when the rest of the state might be opening up. I envision that we will continue to limit the gathering size, and so just because the state might in the upcoming weeks open up some of the restrictions, I would bet that we'll continue to keep a small size. I can't predict what that will be at the current time, but I think it will probably be many months before we can fully open up to unlimited size of congregations. And last, also, I think we will need to continue to work with businesses across the state to create and continue to support remote working for the non-essential come-to-work jobs. All of this will be done as we carefully open up the state to the New Hampshire citizens as we approach the summer season and await for a hopeful vaccine for time after that. As I've mentioned before, the situation with COVID-19 is changing frequently. So please, for the most up-to-date information, go to reputable websites that can be found from links to the CDC from the Mid-State Health Center website and Speare's website. Some of you are also asking and have been asking, how can you help? Please see our website for more information about specifics, but we appreciate all of your prayers, your thoughts, and your support that you've given the healthcare facilities over the last month. I specifically want to thank those of you who've donated cloth masks and face shields, which have become really helpful to us in the last couple weeks. If you have a question about a donation, or whether you feel you might be able to volunteer time, please visit the email, send an email to the site at the bottom of this screen, COVID-19 donations at spearehospital.com, and someone will get back to you about whether we can utilize what you have available. In closing, please don't be afraid, but be well.